Okay, so welcome to our first ever weekly webinar. And so today, what we'll be doing is we'll start off with an introduction to the organization because this is our first webinar, and then we'll have a presentation on neurodegenerative diseases. And then we'll start off with Ucat, like the introduction to Ucat and mental health in the medical field. So yeah, let's get started now. Okay, so what is Aspiring Surgeons Network? So it is basically an organization that is dedicated to bringing together passionate aspiring surgeons and other healthcare professionals. And what we aim to achieve is basically educational growth, career development, networking, collaboration, and uh, the development of leadership skills in each of our members. And so that's why we'll be hosting, um, guest speaker events, so then we can have opportunities to network and collaborate with, healthcare professionals. And I've also gotten this very frequently asked question, which is like, if it's only for aspiring surgeons, it's not just for them. It is also for healthcare, like other healthcare professionals, such as we've got many members that are aspiring medics, aspiring dentists, vets. So it's a huge variety. We just like to focus more on aspiring surgeons because a majority of our guest speakers will be aspiring surgeons. But hopefully soon we'll be getting some physiotherapists and some consultants from various different medical fields to also join. So our mission is to build a supportive community that empowers us to grow as future medical leaders. Um, and yeah, we just want to make it a very supportive environment where we can all help each other. So essentially, what we offer is weekly seminars, including UCAT tips, medical knowledge, and mental health support. So you would be expecting something like this every week. And then we'll also have guest speaker events like the one on the 19th of July, and then essay competitions and or art competitions, which we are thinking of launching soon. So if you're interested in any of that, we would love to have you participate. So now we'll start with neurodegenerative diseases. And this was what you guys wanted to listen to about. So what are neurodegenerative diseases? They are a range of disorders that primarily affect neurons. So we all know that neurons do not regenerate. So this accumulates to an overall loss in neuronal function in the body over time. So, the most common types of neurodegenerative diseases, there is a humongous list when I was trying to make this presentation, but there are four most common ones, which is Alzheimer's disease, which is commonly associated with memory loss, cognitive decline, and behavioral decline. Then we have Parkinson's disease, which is associated mainly with mobility issues such as tremors, bradykinesia, which is like slowness of movement and rigidity in the joints. And then Huntington's disease is basically motor dysfunction, cognitive decline, and psychiatric symptoms. And we'll look into more detail of how we diagnose these certain diseases. And then the other one is amyotrophic lateral sclerosis, which is also a really common one, which affects motor neurons, leading to muscle weakness and atrophy, which is thinning of muscle mass. And then some common causes of neurodegenerative diseases are genetic factors, such as mutations in the PSEN1 gene or PSEN2 gene or the APP gene, which are commonly linked to familial Alzheimer's disease, and then mutations in the HTT gene, which also causes Huntington's disease. One thing that's really common to note is that these genetic factors can either directly cause a disease or it can increase susceptibility to other risk factors, which make it more common for you to get the disease if you have that certain mutation. Environmental factors such as a prolonged exposure to pesticides and heavy metals have also been linked to getting Parkinson's disease, which is why we often see Parkinson's patients to usually be from like an older generation where they were, post World Wars, when they did like when they were soldiers or when they were factory workers. And so these environmental factors can also cause an increase in the probability of you getting Parkinson's disease. And then any external head injuries or traumatic brain injuries are also risk factors for several neurodegenerative conditions because they damage neurons. Lifestyle factors include diet, exercise, smoking, which can also increase neurodegenerative diseases, like the chances of getting them. Not only that, but also any other disease. You are more likely to get a disease if you don't have good lifestyle factors. A diet rich in antioxidants, so something like omega-3 fatty acids, may lower the risks, whereas sedentary lifestyles and smoking are connected to a variety of certain diseases which you're more susceptible to. And now the symptoms of neurodegenerative diseases. So there are three main types of symptoms: cognitive, which can be listed as memory loss, difficulty concentrating, impaired judgment, and language problems. And then we have motor symptoms, which can include tremors, muscle stiffness, and bradykinesia, balance issues, which are mostly related to Parkinson's disease. And then in ALS, motor neuron degeneration, as previously mentioned, can also lead to muscle weakness and atrophy, which eventually starts affecting the respiratory function. Now, psychiatric symptoms include depression, anxiety, and stuff like this, like psychiatric symptoms. Often precede motor symptoms in Huntington's disease, which complicates early diagnosis. Speaking of diagnosis, the way clinicians go on about actually diagnosing patients with neurodegenerative diseases includes first step, which is clinical evaluation. So this includes a medical history, neurological examination, and assessment of cognitive and motor functions. So physicians look for specific signs and symptoms that are characteristics of each disease. And this helps them, classify what disease the individual has. And then step two is imaging studies, which is MRI and PET scans, which can help visualize brain structure and identify abnormalities and also assess the extent of neuronal damage, which can also help them choose the pathway of what type of treatment option they will be going for the certain individual. Then laboratory tests, which include blood tests and cerebrospinal fluid, which you can see from here. It's where you take it off from you take a fluid from between the spine, and this can be analyzed to detect biomarkers indicative of Alzheimer's disease. And then they also do genetic testing, which can be to identify mutations associated with specific neurodegenerative conditions. So one of the treatment options are pharmacological treatments, them being cholinesterase inhibitors and memantine, which are usually used to manage Alzheimer's disease symptoms. So essentially how they work, how cholinesterase inhibitors work is by blocking the cholinesterase enzyme from metabolizing acetylcholine, which is a very common neurotransmitter. And this increases the ACH activity on cholinergic receptors, and which are known to be involved in cognition. So aspects of cognition are also known to be impaired in diseases such as schizophrenia, conditions such as schizophrenia, and so cholinesterase inhibitors have also been proposed as treatments for visual hallucinations, which are often associated with schizophrenia. And then memantine also works primarily by blocking the effects of glutamate, which is another neurotransmitter in your body, and which, when overly activated, can lead to symptoms of Alzheimer's disease. So, decreasing the activity in the brain can also improve cognition and can slow down the progression of the disease. And this promotes neuron synaptic plasticity, and this improves overall neural communication, which helps mitigate the symptoms that are associated with neurodegenerative diseases. Other types of non-pharmacological treatments include physical therapy, occupational therapy, and speech therapy, and these are commonly done by physiotherapists and occupational therapists. And basically, what they help to do is maintain functional abilities, improve mobility, and enhance communication skills. So, the current treatment options that we have available, their aim is to mitigate and reduce the amount of the symptoms that are associated with patients that have neurodegenerative diseases. But there are emerging therapies, including gene therapy, stem cell therapy, and neuroprotective agents, which potentially may be able to cure the disease, whereas the treatment options we have now, they're not really able to cure them. They're just able to control the symptoms. Another treatment option may be lifestyle modifications. So doctors and medics may advise their patients to have a healthy diet, incorporate regular exercise, and also cognitive stimulation, which can have a positive impact on slowing down disease progression. And engaging in activities such as puzzles and social interactions may help slow down cognitive decline in patients. And this is all I have for neurodegenerative diseases. Now I'll hand over to the education officers to do their presentation on the Ucat. And if you have any more questions about neurodegenerative diseases, please feel free to put it on the chat, and then I'll get back to you. Just give me a moment to close my camera, and then we can get started.
Hi everyone, my name's Salma. I'm one of the education officers, and I'm going to start by introducing the Ucat and just going through what it is. So, for those of you who are applying to medicine and dentistry, the Ucat is an admissions exam that you'll be sitting in the summer of year 12. And it's a computer-based exam. So, when you do come to sit it, you'll be sitting it in a test center. I've got a picture of that on the right-hand side of the screen. And also, you will be receiving your score on the day. So straight after you do your exam, you'll get your score in an envelope. And on the right-hand side, I've also got a timeline. So this is the timeline for this year, but it stays roughly the same every year. So as you can see, the bookings for the Ucat open on the 17th of June. So those of you who are sitting your Ucat this year should have already booked it. And then you can do your test anytime between the 7th of July and the 26th of September. And so in your Ucat, you have 3 cognitive sections, and then you have your situational judgment. So the first section is verbal reasoning, and what verbal reasoning does, it assesses your ability to critically evaluate information presented in written form. And that's done basically by testing you on 11 passages. And then your next section is decision making, which assesses your ability to make sound decisions and judgments using complex information. And then after decision making, you'll have your quantitative reasoning, which is basically your math section. And this assesses your ability to critically evaluate information presented in numerical form. So you may be presented with questions such as tables, graphs, diagrams, etc. And then your final section, which is a bit different from the first 3 sections, is situational judgment. And this just basically measures your capacity to understand real-world situations and to identify critical factors and appropriate behavior in dealing with them. So basically what that means is you'll be presented with a scenario and you'll be given around 3 to 4 questions to answer for each scenario. And so how the scoring works is you're given a total score for the 3 cognitive sections between 900 and 2,700. And obviously, as any other test you'll do, the higher you get, the better. And then for situational judgment, that's a bit different because you're given a band between 1 to 4, obviously with 1 being the highest and 4 being the lowest. I think for situational judgment, you should be aiming for at least between band 1 to 2. And yeah, that's it for the first slide. Thank you. So now I'm going to go through how your Ucat score is assessed by different universities. So different universities will look at your Ucat score differently and they'll weight it differently. So for example, University of Bristol, they will have your application scored with 100% weighting on the Ucat, whereas Aston University, your Ucat score only makes up 1/3 of the weighting for the shortlisting process. And then obviously there are other factors that come into play, such as your GCSE grades, your predicted A-level grades, and your personal statement. Some unis will read your personal statement and it will make quite a difference in your application, whereas other unis won't read your personal statement, such as University of Manchester, they don't read your personal statement. So that's where strategic applications come in. You want to apply to universities where you're kind of strongest in. So obviously, if you've got a really strong UCAT, you'd want to be applying to places like Bristol. There's also a number of websites that you can use to compare different universities and how they weight your different sections. So you can use the Medic Portal, Medic Mind. You can use the UCAS website as well. That's quite good. And then obviously you can visit the different university websites and see what kind of requirements they've got. And yeah, that's everything from me. Thank you.
All right, can we have Helene now for her part of the presentation, please?
Can you hear me?
Yes, I can hear you now.
Can you see me? Hi everyone, my name is Helen and I'm one of the education officers here. And today I'll be talking about one of the most important updates in the medical school application process, and it's the changes in the UCAT for 2025. So you may have heard that the abstract reasoning section with the patterns and the shapes has now been removed. And from 2025 onwards, the UCAT will now only include 3 cognitive subtests. So that includes verbal reasoning, decision making, and quantitative reasoning. And that's alongside the situational judgment test. And so the total time for the exam, it remains just under 2 hours. But the structure has changed slightly to balance it out. And one of the biggest changes is that the decision making now has more questions, and it is now made up of 35 questions, which is up from 29, and more time. So now you receive 37 minutes instead of 31. Also, each of the sections now have a 1 minute and 30 second instruction time, except for quantitative reasoning, which gives you 2 minutes. And also the scoring has changed. So before, in previous years, it'd be out of 3,600, but now the maximum score is 2,700, with each section scoring between 300 and 900. And the situational judgment test is still graded in bands 1 to 4. So why does it matter? It affects how universities judge you and their cutoffs, their selection scoring systems. So yeah, it does change for us slightly, but it shouldn't be a huge change. And that's it for this slide. So how to prepare and get the best Ucat score. The biggest mistake students make is cramming for this test like it's a school subject, and it's not. The structure is really different, and the Ucat, it's about pattern recognition, logic under time pressure, and decision making when you don't have all the information. And so it kind of requires a different type of preparation, which most students aren't used to. And my top tips are start with timed practice tests early on and not just untimed practice. Definitely use a timer to kind of like stimulate the real exam like conditions. And when you get something wrong, don't just move on. Ask yourself why you got it wrong. Learn the pattern behind your mistakes and focus your time on your weakest section. Also, and I can't stress this enough, don't waste time looking for Ucat past papers. And having spoken to many medicine students, they say that the Ucat, it's it's a different computer-based adaptive test, so only use authentic resources. And some of the most reliable Ucat like preparation websites are definitely Medify, MedEntry, the Ucat People, the official Ucat website, the Medic Portal. So yeah, don't go off random tangents and find random websites. Find reliable resources. And my final bit of advice is don't wait until the summer to start. Like whether you're in year 11, I'm in year 11 myself, and I've started. So year 11, year 12, or even like a gap year applicant. The earlier you start building familiarity with the test, the less overwhelming it will become, and the higher score you will get. So thank you, and I'll be around at the end if you have any questions.
All right, can we have Neha from the Wellbeing Officers, please?
Hello, my name is Neha, and I'm going to be presenting the mental health segment of this presentation. Medicine is often seen as a noble and rewarding career, and it absolutely is. But it's equally important to understand the pressure that comes with it. Many doctors face burnout, not just from long hours, but also due to emotional stress and the pressure of making life-altering decisions. Understaffing is another major issue, where medics are stretched thin, leaving them less time for each patient and increasing their mental load. There are also moral dilemmas, like having to choose between two equally difficult treatment options. Then there's the lack of resources, which forces medics to work with limited tools or support. Work-life balance can suffer badly. Some doctors barely get downtime. On top of that, many face violence or abuse from patients or families. And unfortunately, there's still a strong stigma around mental health in the profession, which makes it hard for medics to seek support. All of these challenges are real, and it's vital we acknowledge them if we're serious about becoming future doctors. Please may you move on to the next slide. Thank you. So why should we care about this now, before we've even started medical school? First, it helps set realistic expectations. Knowing these challenges in advance stops us from walking into medicine with rose-tinted glasses. It also gives us time to build mental resilience, preparing us emotionally for what's ahead. By learning about the realities early on, we can make better decisions, like confirming that medicine truly is the right path for us. This understanding also gives us purpose-driven motivation. It's not just about prestige, but about committing despite the pressure. It helps build empathy too. When we hear doctors talk about their experiences, we'll be able to relate instead of being shocked. And when it comes to applications and interviews, this awareness shows maturity and insight, which admission teams love. In the long run, all of this helps us prepare not just to get into medicine, but to succeed and thrive in it. So, what can we actually do right now to prepare? First, time management. Learning how to balance schoolwork, volunteering, and rest will set you up for the intense workload of medical school. Stress management is just as important, whether it's mindfulness, journaling, or going for a run. Find what works for you and make it a habit. We also need to build resilience, the ability to bounce back when things go wrong, whether that's a bad grade, a rejection, or burnout. Communication skills are another key area. Practicing how to speak clearly and calmly now will pay off massively when talking to patients later on. And lastly, don't underestimate the power of healthy habits. Good sleep, nutrition, and regular downtime. These are the foundations of long-term success and mental well-being. By starting these habits now, we're not just preparing to apply, we're preparing to thrive as future doctors. And before I finish, I'd love to leave you with one question. What kind of doctor do you want to become? And what are you doing today to become that person? Thank you.
All right, thank you so much for that wonderful presentation from our well-being officers and education officers. And now I would like to send in the attendance form link in the chat, and please make sure to fill it in because if you attend 5 of our meetings, you will be getting a certificate. I'll stop sharing now and then send you link. And then if you have any questions, we'll stay around and just answer your questions.